your genes can be influenced by hormones. And so that's typically when we do see different changes in hair texture is when there's different hormonal changes. So that can be during puberty, after a baby, or if you're on any type of like a hormone replacement. A lot of people say after chemotherapy, their hair grows back.
Stress is the inflammation that robs us of life, energy, and happiness. Our typical solutions for gut health and hormone balance have let a lot of us down. We're over-medicated and underserved. At The Less Stressed Life, we're a community of health-savvy women exploring solutions outside of our traditional Western medicine toolbox and training to raise the bar and change our stories. Each week, our hope is that you leave our sessions inspired to learn, grow, and share these stories to raise the bar in your life and home. All right, today we have Samaria Grandberry, who is a licensed and registered dietitian nutritionist. She is also a proud student of trichology through the World Trichology Society and founder of Feeding the Root. Through Feeding the Root, she provides evidence-based nutrition and trichology therapy to empower individuals to make more informed decisions about hair and health. Driven by her love for wellness and her own hair issues she's overcome, Ms. Grandberry takes pride in helping others get to the root of their hair and scalp issues. And with her past experiences in professional training in nutrition and trichology, she's bringing a fresh treatment option to the field. I'm so excited to talk about this. I found Samaria very oddly, through Instagram rabbit holes with like a friend. I'd met Jackie Johnson, who I just loved. We did a lovely interview and then I was on her Instagram. So anyway, in a roundabout way, Samaria commented on that and I saw she did some scalp and hair therapy and people want this topic. So I'm so excited to have you on today to talk about this. Welcome, Samaria.
Thank you so much for having me. I'm really excited to be here today.
Thank you. So I want to talk about, I think your story probably has a lot to do with this. Mm-hmm. So let's just get it out there. Let's talk about why you would spend time going to school for 4 years, plus at least 2 more years for a master's, plus another year for trichology, which we'll talk about next. But I'm going to guess you weren't just like, oh, I'd like to just be a permanent student. So even though it's great to always be learning and to always be a student, but talk to us about your own hair and scalp issues and what happened and how that's led to where you are now.
Yeah, so I kind of have different experiences, like growing up, my experiences with my family, and then also like personal experiences. So I'll take it back to my childhood and kind of high school. I grew up very active, playing basketball, soccer, all these things. I also grew up on a small farm, so outdoors, agriculture, and I grew up eating a very typical African-American Southern diet. But I also grew up watching my dad struggle with psoriasis. He has psoriasis on his scalp. My dad was a landscaper, so he was outside, exposed to lots of different things outside. So he's used a tar gel from his dermatologist for really as long as I can remember. And, the psoriasis spread from his scalp to his body, but he always just used that tar gel, for psoriasis. And there's also other women in my family that have struggled with hair loss, and they've worn wigs and hair pieces their entire life, to cover those things up. They go to their dermatologist and they go back to their cosmetologist, and then back again in order to cover it up or, get shots or steroids or whatever it is, and they're still struggling. And there's really no one in my city who is offering the treatment option that looks at the whole person and not just their symptoms. And so that's really my experiences with my family. And then with my own personal experiences, from a young age, I grew up getting chemical relaxers. So I was getting these chemical relaxers on my scalp to straighten my hair. And I always wore my hair straight all the time. It never grew past my chin. It was always really short. And I remember having chemical scalp burns. In middle school, I would have, burns on my scalp. And then over the summer, I would get extensions. I would get braids so that I could swim, sweat, play basketball, do all these things freely. And then in high school, I went vegetarian. So I went vegetarian. I don't know what inspired me to go vegetarian, but I ended up going vegetarian in 9th grade. And then I also went what I called vegan. It wasn't a healthy type of vegan. I was just kind of not eating chicken nuggets and eating French fries. I don't remember anything super traumatic happening, but I know that I wasn't doing what was best for my body because my hair wasn't growing well. I had just cut off all of my chemically relaxed hair. And so I was dealing with this new hair texture. My body was changing rapidly because I was a teenager. I was going through puberty, doing a lot of sports and things like that. And I wasn't giving my body what it needed to really thrive. My hair was, super dry, brittle. I remember, dealing with like really dry dandruff, scalp. I didn't have a regular menstrual cycle until I went to college. And so it was just a lot going on like in high school. And I didn't know that I wasn't giving my body, what it needed. And so like with more education and more experiences, I realized that I was doing it all wrong. Just because I wasn't eating meat doesn't mean that I was healthy. I probably was really under eating for the rate of like my metabolism like at that time. And so I really shouldn't have excluded all of those things. And so that all of those kind of brought me to kind of where I am today and really being interested in trichology and studying trichology. And so nutrition is the second leading cause of hair loss around the world, right? And as a nutrition professional, I'm like, I am uniquely equipped with the education and the tools to bring this treatment option to the field and combining it with trichology and also having that education from like an external perspective as well as, combining it with my training as a dietitian to bring this treatment option to the field. So yeah, that's kind of my story and kind of what has brought me here today.
Well, I want to talk about your story for a moment before we get into trichology, because I think that people can see themselves in everyone's stories sometimes, right? And so the first thing that stuck out to me is that you're getting chemical relaxers. And so we're burning our scalp, which reminds me of when I used steroids short term for my skin issues and thinned that skin. And then later on, I would burn my skin accidentally with the stuff because it would be much more sensitive. So sensitive scalp, sensitive skin. I think when we say that, we need to point out that this is like, it's a thing. And also, it's also a not funny, but we all are like this as humans. We all want to have what we don't have. And so it's like, you probably have gorgeous hair. I'm just going to guess. My sister-in-law I'm going to guess maybe you have curly hair if you're getting relaxers. My sister-in-law has like this gorgeous curly hair and she straightened it one day. I was like, what are you doing? It's so beautiful, right? But we all feel this way. We all want the opposite of what we have. And that's okay. I think it's like good to say it out loud. And so it's interesting that you knew so many people that struggled with hair loss and you recall that. Maybe it's relevant to maybe mention, maybe not, because I think absolutely anything with skin or hair moves us to action in a different way than other symptoms. Because it's vanity, whether we like it or not. It's not really, it's not okay to lose our hair and have skin rashes and whatnot. It's not really, but it like moves us to action faster than some other things because we don't feel good about ourselves. And you mentioned this somewhere, like everyone wants gray hair, but culturally, if you struggle with hair as a Black woman, it's like really not okay, right? Like everyone's into like, wait, like it's a really big deal to have amazing hair. To be told that you have a gorgeous hair is like the best, it might be like the highest form of a compliment, right? Like I would like that compliment too, but like, I think it's like more ingrained almost, right? Isn't that true?
Yes, for sure. But like in our culture as, African Americans, as Black people around the world, hair is such a huge part of our culture. And so, when you are losing your hair, it's just so much more significant. And I think that seeing a practitioner or someone that is outside of your culture, and look at your hair as more just like a symptom, like your hair loss as a symptom, and not take into account that this is a big part of your culture and how you see yourself, how people, how other people see you. It's definitely really important. And so that's why, I am excited to work with women, in my area that are within my culture to help to show them like, hey, I see it all. I'm a part of the culture. I see it. I know that you have, worn wigs all of your life to try to cover this up, but like, hey, let's get to the bottom of it and figure out what is the root cause of that. So.
Yeah. Pretty dang excited that you're filling that gap, especially. And also you didn't like go out and practice for a long time to realize that you wanted that. Like you saw it right away, which kudos to you because not everyone could, like we tend to go and do the traditional thing and realize, I think I'd really like to do that thing I'm passionate about. And as a side note, I think it's also relevant to mention, you said what I call vegan, like I was changing out chicken nuggets for French fries. And I would say, I think I see this a lot. And I imagine there's listeners that hear that see their high school daughters or friends' daughters that are going vegetarian. And I don't have comments necessarily positive or negative, but vegan, you have to do quite carefully because we're not getting good amino acids. And I have a lot of feelings about that because of what we see in practice, but that's okay. You're acknowledging like it wasn't really working super well. So,
right.
Okay, before I read your bio, I didn't even know the Society of Trichology was a thing. So tell me about how you, found out about them, got interested in them. Tell us about what trichology is and like what's going into that.
Yeah, so like I said, I obviously am a dietitian and we don't really learn about hair loss in school. And so a couple years ago, like I've always loved like hair and learning about my hair and like the science of my hair. And so a couple of years ago, I looked into like professional study, of trichology because I didn't know what it was either. I mean, trichology is a relatively new practice in the US, even though it's been practiced around the world and in Europe for decades. It's relatively new in the US. And so just kind of looked on Google for some professional education and I came across the World Trichology Society, which is a society that trains cosmetologists, medical professionals to become certified trichologists. And, certified trichologists, they don't diagnose or anything like that. It's typically seen as the bridge between cosmetology and dermatology. So whereas, cosmetology is going to look at things from a more external perspective, cover things up, make things look pretty, dermatology, more like a medical doctor. So, medications and things like that. Trichology is kind of that bridge. So when you go see a trichologist, say, for example, like you went to your cosmetologist and they gave you a hairpiece to cover it up. You went to your dermatologist and, they are giving you steroid shots or something like that. You go to a trichologist and your trichologist will do a very thorough medical history. Well, let me say the World Trichology Society trichologists are trained to do a very thorough medical history and really find what it is. Like if it's, it's your thyroid, if it's nutritional, and then refer you back. So almost give you the tools to go to your dermatologist or go to your physician or go to an endocrinologist to say, hey, this is what was found. And can you help me with this?
I love it.
So that's basically like what trichology is. I will say that, medical science is really just starting to understand these issues related to like scalp and hair health. So there's not a lot of definitive reasons, but we do know like common triggers and how to address those.
Side note, my brain just went here. I mean, there's like a slightly different microbiome going on up here in the scalp, right, than even the rest of our body. And we've like addressed skin stuff for a long time. But like you said, hair is typically been cosmetology. We haven't really had, something beyond dermatology to really look at it, but it's slightly different than really the other areas of our skin. So, and actually another random side note, is trichology just scalp hair or is it like other hair on your body? Other as well?
So typically it is just like scalp and hair health. Yeah. And then also like kind of to your point, we just think of like cosmetology just kind of thinks of the hair and not just like that there's an entire, piece of skin underneath the hair. Which is super important, because that's where your hair grows from. So it's like without that healthy scalp, the hair doesn't grow well. So
you mentioned that it's kind of new in the US in general, but it's been around longer. So can you tell me about the roots of trichology in the sense of like, when you say that, does it have roots in a particular culture or a country or whatever? Or like, who was the guy, and maybe you don't know, and that's okay too, or who kind of started it? A little bit more about like where it comes from in general.
I don't know a lot about like where it came from necessarily. I do know that I think originated in Europe in like the early 1900s. So I think trichology was even like established before dermatology. I want to say trichology was established in like before 1910 and dermatology was established like around 1920 or so, like in the US. So
Interesting. So we're going to talk about nutrition and different hair and scalp issues and then also comment like root causes and stuff. Let's start with, I think the nice bridge is that, you're talking about being a dietitian, which I wonder if you were inspired to be a dietitian through different means than where you decided to focus on hair health. You can feel free to insert that here as well. But let's talk about, you mentioned nutrition being the second leading cause of hair loss. So let's talk about like what that actually means from a nutritional perspective. Give us some real life examples of when this is going on, you will see hair loss, or when this is going on, you will see hair loss.
Yeah, so there's a lot of different reasons of hair loss. Number one is genetics, but number two is nutrition. And so, with like restrictive dieting, calorie deficits, extreme weight loss, those are very common causes of hair loss. What we call telogen effluvium is a diffuse throughout the entire scalp, not patchy type of hair loss. Typically comes back after the trigger, digestive issues, things like that, where you aren't digesting the nutrients because your hair is a non-essential tissue, right? So your body is going to use the foods that you eat and the nutrients to nourish and energize those major organs that are necessary for you to live. Like things like your hair and your nails aren't necessary. And so your hair will definitely be the first one to be affected by that change in your diet or that extreme weight loss. That's something we also see with like bariatric surgery, from the stress, the surgery, and then also from the decreased surface area with the stomach. You see, that telogen effluvium. So yeah, nutrition is definitely a major cause and probably one of the most common that a lot of people don't even see as a cause. We don't kind of connect those and look at the body as a whole.
Mm-hmm. That was the first thing I thought of when you mentioned like extreme weight loss. It's like couldn't be a more significant one than that. And I don't know who created bariatric surgery, but what were they thinking when they changed the stomach from 50 ounces to 1 ounce? Like, couldn't you have picked something more in between than a 50 time reduction? I just don't even get it. Like,
right.
Maybe it worked well. I don't know. It just seems a little excessive. That's all. It's hard to digest and absorb things when you reduce all that surface area, but I digress.
And then, with bariatric surgery, they have to take, supplements and vitamins.
But they're not counseled about that very well.
Right. And a lot of patients, like I see so many trichologists will refer patients to me after bariatric surgery. And I'm like, oh, because the hospital, where I worked, there's a bariatric clinic there. And we worked in as dietitians, we worked in the bariatric clinic. But I didn't realize that so many clients aren't counseled besides their doctor or a worksheet, after bariatric surgery. And I'm like,
the evidence is clear.
I'm like, how could you not be?
Right. I know. It's like, how could you not be? But we become a little bit like, there's rules, right? You're supposed to have like this, it's supposed to be signed off on by a dietitian. And I think most bariatric centers do have like a specialty person in that area. So I think it just depends. I think people slip through the cracks a lot too. Like, I think you just like get things signed off. And I mean, that's what I've seen because I've done the consults before. They're like, they needed someone to do the consult. And a lot of times, like literally what medical stuff is like cleaning up pieces of like, well, can't do anything about that now. So let's just go in and deal with the repercussions of it. And like, here's the situation. So anyway, I was actually going to ask you, speaking of calorie deficits, I thought about this with your story. You were talking about being kind of an athlete or being very active and whatnot and having calorie deficits. Did you have a menstrual cycle at that time?
No, I didn't. Yeah, that's what I mentioned. Like, I didn't have a regular menstrual cycle until I was in college.
Yeah.
So it was a very long time of up and downs. And sometimes I did, sometimes I didn't. I'm now looking back, I see why,
Right. Yeah.
So.
Okay, cool. So first reason, genetics, then nutrition, including extreme weight loss, calorie deficits. You mentioned telogen effluvium is hair loss throughout the whole hair, and it usually comes back after that trigger. Could be gut issues because you mentioned hair is not essential. So it's going to be lost first, which is kind of a cool way to think about it is that, you talk about this for fertility too. It's like the body is super smart and it's going to like put resources where it needs to if it's in a place of like distress, right? And we tend to we're so good, especially in America, like ignoring distress, right? So were there other nutrition related hair loss and scalp issues on the list that we should keep going?
I think so. There's like iron deficiency. So there's like, there's a lot of different, there's anemia. There's a lot of different vitamin, like protein deficiency, for someone who is like, vegetarian or vegan, protein deficiency, iron, iron deficiency. Iron deficiency is huge, and you start just like, shedding your hair.
And then thyroid issues being related to iron issues. Yeah. Super thing. And so like that probably takes us in a little bit to, I don't know if it does. I know like one of the topics you had was like hair changes after puberty and pregnancy. And actually I'd like to go there because those are like common times people would see a change in what their hair is doing. Now you mentioned telogen effluvium, which is like hair loss everywhere for a short term and then usually comes back. Maybe do you also want to tell us about some other common types of hair loss as well? Or maybe it relates to pregnancy or puberty or whatever in general. Will you just tell us about hair changes with puberty, pregnancy, whatever?
Yeah. So I can just tell you a little bit more about some of the main causes of hair loss, and then we can kind of go into talking about like puberty, hair changing. So just as like a little bit of a backstory with hair, it grows in 4 stages: the anagen phase, catagen, telogen, exogen. So the anagen phase is when it's growing, about 2 to 7 years, depending on, your genetics. Then the catagen phase is what we call follicular regression, which the hair strand detaches from the follicle. That lasts about 1 to 3 weeks. And then the telogen phase is when it sheds. So it's in that resting period, and that's when the hair comes out. And then there's like the exogen phase. So those are the 4 stages of the hair cycle. And if at any point, for example, if your hair is in the anagen phase or and you go on an extreme calorie deficit, your hair can you can stop that anagen phase and push it into the telogen phase prematurely, which causes that hair loss. So any trigger or anything that happens during those phases can push your hair out of the anagen phase into the resting phase and then into the exogen phase where it sheds.
I have some questions about this.
Okay.
One, will you tell us how long the telogen phase is?
So the telogen phase is the resting period, and it lasts about 3 to 4 months.
Okay. And what was the purpose of the exogen stage, and how long is it?
The exogen phase comes out, it sheds, and it's about 1 to 3 days.
Okay, thank you. So my question is, if anagen is growing and it's 2 to 7 years, hair all over could be in different stages, right?
Yes, because there's about 100,000 hairs on your head, right? And each follicle can contain about 3 to 5 strands of hair per follicle. And so they all can be in different stages at different times.
And as a side note, just only because I was doing some clubhouse rooms on this recently and another podcast, is that we were talking about collagen, and collagen degrades as we get older and is part of like holds hair into its place. So just aging without good collagen will release the hair is part of it. And I wonder, I'm sure like tons of other nutrients, right? There's always tons of nutrients involved, in general. Okay, so we got these 4 stages. If we're in a deficit, we may stop a stage and then jump into the loss stage, essentially, which is like not cool. So this should look like, if you're having hair loss related to these stages, that should look like more patchy in different areas, because if the hair is growing in different stages in different places, then you shouldn't be losing all your hair. Whereas you were talking about telogen effluvium, which is like all over hair from a shock, from a trigger, and how long after that trigger is usually typical?
So it's about 6 to 16 weeks. So around, maybe around like 3 months or so, you can kind of see it. So I just wanted to clarify, the telogen effluvium, it's not like a complete baldness. It's more so just like thinning. So it's you're noticing more hair is coming out in the shower, more hair is coming out in your brush.
Like in clumps sometimes?
Yes. Yeah, kind of be like in clumps. There's not any bald patches in particular. That would be more like maybe like androgenetic alopecia or alopecia areata. But with the telogen effluvium, it's more diffuse, just thinning overall.
Well, now you have to define the 2 types of hair loss that you just mentioned.
Yeah, so
just glaze past that.
So yeah, we kind of go into some of the like very common like hair loss. So there's androgenetic alopecia, which is the most common hair loss due to your genetics and your hormones. So it's basically where your testosterone is overrepresented in your body, and that could be due to a lot of issues why you have excess testosterone, and it's converted to DHT, and DHT is what causes hair loss.
My coexists with PCOS, which affects, I don't remember how many women, but one of the things with PCOS is elevated testosterone. In case that's useful for someone listening.
Right. And that's something that you see a lot is, the androgenetic alopecia, or, if on different types of like hormonal replacements, things that are anything that's really changing your testosterone. And you typically see it at the top of your hair. It starts with like your crown. And so that is typically what happens when you have the genetic hair loss. You'll start thinning right at the crown of your hair. It will start becoming a little bit thinner. There's different patterns that we see that kind of help us with the assessment and the diagnosis of what kind of hair loss it is. Cool. And then the alopecia areata is the autoimmune condition that causes like bald patches. So like there's smooth bald, like in that one, like it's typically circular, smooth, and there's those bald patches, throughout your hair.
And then you could lose all of your hair, right? Starts as patches, but then you could lose it.
You can go to alopecia areata, alopecia universalis, and alopecia totalis. So that's like where you lose hair everywhere on your body.
Got it. Well, I got us a little off topic because we were going to talk about hair changes after puberty and pregnancy, and then you told us about phases. So let's return to that.
Okay. So we'll kind of go into talking about like the reasons why your hair can change when you go through different stages in life with like hormones. So science doesn't completely understand why this happens. There's different shapes of the hair follicle. If you have straight hair, if you have curly hair, and it's typically that's determined partly by your genes, the genes that you have. And so your DNA might cause you to have perfectly round follicles, which would result in straight hair, and then more hoop or like hook shaped follicles will, result in curlier, more coily hair. And so that's kind of how it's determined by your DNA. But we know that like your genes can be influenced by, your hormones. And so that's typically when we do see different changes in hair texture is when there's different hormonal changes. So that can be during puberty, after a baby, or if you're on any type of like a hormone replacement. A lot of people say after, chemotherapy, their hair grows back, with a different texture, a different density, different feel. And so like I said, it's not completely understood by science, but it is typically seen, those genes maybe being turned on or off due to like your hormones and different lifestyle factors.
Okay, so this reminds me of people talking about when I hit puberty, I got curly hair for the first time. So literally their follicles changing shape due to hormones. Wonder how common that is.
Yeah, I know. I actually have a friend who she just recently got off hormonal birth control and she's noticed her hair. She's around 26, I want to say. And she just recently noticed her hair is starting to become straight. It's growing out straight. So your hair used to be curly and now it's straight. So I don't know. I'm not sure how common it is, but I definitely have seen it.
Would you say going off of hormonal birth control can be a common reason for hair loss?
I'm not really sure. I think that when you are coming off hormonal birth control and your hormones kind of are starting to like level back out, that might cause hair loss. I think it would manifest differently for everyone, depending. So.
Yeah. And there could be those nutrient deficiencies that are caused. I mean, it could be a lot of things because it could result in gut stuff.
Right.
So anyway, something had landed in my inbox today and it made me think of that. Okay, so we talked about puberty, hair change and shape. Let's talk about pregnancy a little bit more because it's kind of normal postpartum to lose hair for a little bit. Can you speak to that?
Mm-hmm. Yeah, so when you are pregnant, right, your levels of estrogen and progesterone are different versus like once you have the baby, right? So when you have the baby, your levels of estrogen and progesterone kind of level back out depending on if you're breastfeeding or not. I would say that it's typically about 3 months after you have the baby is when you're going to start noticing that the hair loss. Typically, a lot of people see it like in their crown areas. Some people, they see it just kind of telogen, effluvium all over. And it's due to those hormone levels of progesterone and estrogen, maybe more DHT, producing more DHT, causing more of that hair loss that wasn't happening during the pregnancy. And so that's typically what that program is. And with Telogen, your hair typically comes back. So if you aren't breastfeeding in 3-4 months after you have the baby and you're still losing your hair, I think that's when you would probably need to go see someone because typically your hormones should be leveled back out by that time.
Got it. Perfect. Okay. We've been talking about hair loss quite a bit. So let's talk about scalp conditions a little bit and root causes because this actually sort of doesn't really get much attention at all, does it?
Right. Like we have an entire layer of skin underneath our hair, right? And it's important to talk about because I feel like sometimes in the beauty industry, we talk about the split ends, we talk about the hair strands, but as soon as the hair comes out of the scalp, it's no longer alive. It's a dead piece of fiber. And the scalp is important because, that's where your hair comes from. And there's a layer of muscles and tissues and, nerves underneath the scalp that are important to pay attention to. So I'll just kind of briefly talk about 2 of the most common scalp issues. And one of them is called Pityriasis, Capitis, which is also known as dandruff. And then the other one is called Seborrheic Dermatitis, or for short, Sebderm. So with the dandruff, it's, like I said, it's not completely understood what the root cause is, but we understand that there's an imbalance of fungus called Malassezia ovalis. I think that's how you say it. And that's kind of the most accepted condition, reason why, there's that dandruff. And it can be caused by stress, hormones, oily scalp, because the yeast feeds off of the excess oil. And then with seborrheic dermatitis, so sebum, we have these on the scalp. They're sebaceous glands, and it's an excess of those sebaceous glands. So something in the body is triggering those sebaceous glands, in excess, and it's putting out all of this sebum onto the scalp, leading to an overgrowth. And there's a balance. We need that balance. It protects the scalp. So when it's hot outside, that sebum, the body adapts so that sebum can lock in the moisture on the scalp. And then when it's cold outside, right, it adapts so that it can protect the scalp from the cold. That's an important mechanism. We need that sebum on the scalp, but an excess of that sebum on the scalp can cause like super oily scalp, red patches, and really stubborn dandruff. It can even manifest like behind your ears or in the cracks of your nose. It doesn't just affect your scalp. And so there's a couple of stimuluses that we kind of like to look at, like when it comes to like weather or stressors on the nervous system. Stress, obviously, as you know, like working with skin stuff, can really manifest in so many different ways. And it can definitely be a really huge trigger of seborrheic dermatitis. And then there's chemical triggers. So like hormones, nutrition, different pathogens can cause seborrheic dermatitis to flare up. And so really there's things that we can do from a topical perspective to kind of manage those things. But there's always, a deeper trigger that is stressing out those
sebaceous glands.
Yes.
Yeah. Thanks for answering the question before I even asked it, which was like, ooh, why would we have overgrowth of sebum? So weather, stressors, so many, right? And I often will tell people that we don't usually note or see always how stress is affecting our skin until it's improved a little bit. And then we have an overt stressful incident because it's having a downstream effect on gut and all kinds of things. It's like the way it affects everything else is probably really affecting it. It's like a secondhand cause almost, right? Like, this happens and then this type thing. And I was actually going to say, I feel like oily, like more sebum on the scalp probably also has, like, as you mentioned, topical stuff, there seems to be a whole thing around like ways to wash hair, which I'm not, way probably more into, but also like I look at the inside. So I'm like, I feel like it happens with gut stuff. And you mentioned pathogens as a potential cause. So I'm glad that you feel that way as well. And I have a question. Is it incorrect then to call seborrheic dermatitis dandruff? Because I feel like we use that pretty interchangeably.
So yeah, it's definitely different. So the Pityriasis capitis is like going to be the dandruff. It can be like oily dandruff, or it can be like more dry dandruff, but that is its own condition. And then the seborrheic dermatitis, its own separate condition.
But it doesn't really look different, does it? Or does it?
Yeah, it's actually, to the, I guess, layperson, it might not look different because I actually had worked with someone who thought they just had really bad dandruff throughout their entire life, but they actually have seborrheic dermatitis. And one of the telltale signs of it is that it's not just in the scalp. It's also like behind the ears, and it's also, in the cracks of the nose, and it's more yellowy than white. So like that waxy sebum is building up, and so it's more yellowy than like the white dandruff.
Well, as someone who knows these things personally, I would just echo, and I'm sure it's not every single time, but like as pathogenic or gut stuff is worse, I feel, and this is like maybe different than what we universally accept, but I feel like that changes from like yellow to white to less severe, whatever. And I mean, as a side note, like I just feel like that's what I see in practice with people and within my own history. So it's fun to talk about. Not really, but kind of, but good. Like someone needs to talk about it. I'm glad we're talking about it. All right, cool. So let's talk about resolution a little bit. And I think what I want to really highlight here is like, what is normal for regrowth? And this might go back to like how hair grows, because this is the hardest part, is that usually someone's probably not going to listen to this unless they feel kind of personally affected by it. Maybe they will, but maybe they will because they're awesome and they just are interested and they want to know it for their own practice or whatever. Or maybe they want to share it with a friend. Yes. So that's good. But there's a good chance that if someone's listening to this, they might be affected in some capacity, whether it was through puberty, pregnancy, or a more significant hair loss. So if someone's dealing with, I think, a more significant hair loss, I think it might be nice for us to mention what would be an expectation if things are going, like if you're doing the right things, like it's not super duper fast, right? It takes a while for hair to grow in. So like how do you help guide people with expectations around timelines for regrowth?
Right. So I'll say that the hair really only grows about like 0.1 to like 0.4 millimeters per day, right? So that's about 12 millimeters per month. So it's a very slow growing process. Granted, the hair does like turn over really quickly, right? It's a lot of cell turnover happening in the hair follicle. So it is growing really fast, but you don't see the hair grow really quickly, especially when there's maybe a traumatic issue or like after chemotherapy, the hair follicle might need some time to kind of like readapt. So I would say for like definitely traumatic like hair loss situations, I would say 6 months. At least it takes time. The body has to kind of rework itself and kind of adapt and refocus its energy on regrowing hair. So I would say minimum 6 months. It's definitely a process and it takes patience. I think it also is important when I'm working with my clients is to like look at other things happening in their life, because typically, it's not just hair loss. And so looking at other things that are happening in their lives that are improving and getting better as well.
Right. Celebrating the things that are not just hair. I would say the same thing about skin. which
Right.
pretty much has a ton of overlap. So it's not like we just have to go by literally physiology. It's like, hey, it only grows this fast when things are working well.
Right.
So, but that's slow and we're impatient people. So what is your advice, from a totally different perspective here? What can a woman do in the interim to kind of help make things work? Maybe it's a wig, maybe it's not. Like, what kind of things do you tell women, or what do women come to you with that they're using for coping mechanisms on the interim when hair loss is going on? And as a second question, what would you say to a woman to help her keep her head above water when she feels like this just sucks?
Right.
What are your thoughts?
So in the waiting period, that's kind of where trichology comes in. There are different trichological treatments that we can do, like that are approved by the FDA. There's the laser hair growth. I'm not sure if you've heard of it. Is approved for hair growth. So stimulating those, making sure that the anagen phase is as extended as possible. Granted, like we said, from a physiological level, it only grows a certain amount per day. But we can use things from a topical perspective, kind of encourage that growth. There are other like different creams, different like herbals, oils. There's not a magical hair growth oil, right, that is going to make it just grow exponential amount in a short period of time. But there are different things that you can do. Like you were kind of also saying, like, hair toppers, wigs, wraps. The only thing I would say is that ensure that you aren't causing more damage. So like I know in my community, like we will wear cornrows, like cornrow our hair down and then put a wig on top of it, right? But those cornrows are probably causing a lot more tension. And then there's such thing as tension, traction alopecia, right? That is from that tension. So when you are looking for things to kind of help cover up that hair loss, make sure you aren't doing more harm than good in that. And then there's a lot of different, I know, for women who are going through, chemotherapy, there's a lot of hairstylists that specialize in creating like medical wig caps and things like that. And I think that's also another huge part of what, I do as a trichologist is helping people prepare, for that. Because sometimes it's like you kind of have to go through the hair loss because your body is trying to take care of something else, and so trying to like just mentally prepare and get your mind ready. Like mindset is so huge, right? When it comes to making change, when it just comes to preparing for something, how's your support system? How do you see yourself more than just your hair, And so preparing women to, for that hair loss and kind of in supporting them in that.
Yeah. I'm so glad we can't understate it. That's my point. So I'm glad you brought that up. So, and it's nice to have someone who can refer you to like a place that makes great wig. I mean, there's great wigs, right? There's good options, but when you're wearing a wig, aside from like having your hair roll tightly, wearing a wig, are there some that are so tight fitting that you can have some damage or breakage?
Yes, for sure. Yeah. You can like, especially, if you have the band around your hairline, because like the hair around your hairline, there's a lot of vellus hairs there, a lot of short, like fine hairs that can be easily torn out by this traction. And so if you are wearing, a wig, you definitely want to be careful, like underneath that wig, like how are you caring for your hair underneath? Because it definitely can cause like traction, make the hair loss worse.
I love it. It's been so much fun to talk about all things hair and scalp health and bringing awareness to the scene in all the ways. I'm just happy we got to have this conversation. You mentioned helping people keep their head above water is like mindset stuff. Is there anything, like if someone was listening to this and they're going through hair loss, is there anything you want to say to that woman or that man?
Yeah, I would definitely just say like encourage you and know that like you're not alone in that, because over half the population suffers from hair loss or some type of scalp issue in their lifetime. And also like, I want you to know, like, you aren't crazy, like, your body well. And even if you've gone to the doctor and they say that your blood panel is fine and everything's fine, but your body, that your hair is thinner than usual, or you're noticing it's not normal. So know that, and definitely like keep searching, looking for someone, a practitioner who is going to look at you as your body as a whole and give you the help that you need. And along those, with that, like the WTS, so the World Trichology Society, they have a directory of trichologists throughout the world that are trained. We also go through like continuing education. So we're continually studying and learning in order to keep our certification. And the directory is on www.worldtrichologysociety.org. I mean, you can just go in and put your location, and you can find a trichologist near you.
Super helpful. And we've done a good job of promoting the World Trichology Association or Society today. But tell us where people can find you online.
Yeah, so you can find me at www.feedingtheroot.com. I'm also on Instagram at Feeding the Root and also on Facebook at Feeding the Root. And I just talk about, nutrition. I also love gardening. So sometimes talk about gardening and, where you're learning where your food comes from and things like that. But, I talk a lot about hair and scalp issues just from a nutrition perspective and trichology. And on my website, you can also learn more about like my mission and how you work with me, services that I offer and things like that.
Love it. Thanks so much for coming on today.
Thank you.
Sharing and reviewing this podcast is the best way to help us succeed with our mission to help integrate the best of East and West and empower you to raise the bar on your health story. Just go to reviewthispodcast.com/less stressed life. That's reviewthispodcast.com/less stressed life. And you'll be taken directly to a page where you can insert your review and hit post.